evening if you're tuning in from some other part in the world, because I do believe this is being simulcast. We do have one of our panelists today that will be joining us from Switzerland, I believe. So we are certainly international in spirit. I am Michael Levy. I run the Digital Health Institute for Transformation. It is an education and research nonprofit 501c3 that supports individuals, organizations, and communities through the process of digital health transformation. Please reach out at Michael at dhitglobal.org if you have interest in learning more. I'd like to welcome a couple of our panelists here, actually three. I've got Sasha Cahill on screen here. She is a entrepreneur, mentor, investor, digital health extraordinaire, looking from a lot of different points of view in the digital health ecosystem. I've got Dr. Margaret Lozovatsky, Dr. L for short, so I don't ruin that name, going forward. Dr. L is the Chief Health Informatics Officer for Novant Health, a pediatrician by training, an informatics mind from the very beginning, not one that has just found its way. And Amber Fencl is the SVP of Digital Health and Engagement at Novant Health as well. And I'm excited about this panel, meeting the patient where they are. From my perspective, that's the holy grail, really. Meeting the patient where they are, I think in a lot of respects, starts with a location specificity in mind, but if we unravel what that means to meet the patient where they are, we get into some new layers of complexity. We have to ask questions such as, where are they in their location? Where are they in their age? Where are they in their health? Where are they in their cultural sensitivities, in their day in their life? What access do they have? I mean, the questions go on and on, just to understand what that means as it relates to where the patient is, and us as a system of service providers and solutions and health systems, payers, to meet them there. That's what this panel's about. It's about patient-centered, about data usage to unlock knowledge, to understand the needs of our patient. It's about rallying a supply chain of services and solutions and people and models to support that inevitability and that hope and that promise of serving our patients, us, where we are. So I'm super thankful, excited, humbled, honored, and grateful for having this discussion today. I'm going to start off from a macro perspective. Sasha, I'm going to ask you a first question here. When you look at the U.S. health system at an aggregate perspective, macro perspective, from the state of maturity, where do you feel we are as it relates to meeting the patient where they are, in the context of what possibilities and potential we have versus what realities we are actually adhering to?
That is a great question, Michael. I think that I must recognize the progress we had made. And I think COVID has accelerated the need to include patient in the conversation and deploy some solutions that allow to improve the care for patients, including the outside of the hospital setting. And so I see an improvement. And as a matter of fact, as far as funding is concerned, we have the numbers also to back up that positive trend. And of course, it is really important to say that in the healthcare space, innovation has to deliver practical results, and innovation has to follow regulation. And with that being said, again, noting the obvious and the positive, we have had some changes in regulation that include remote patient management, which involves patients in their care delivery in another, I would say, more meaningful way. And obviously, that allows to improve the outcomes, it allows to decrease the cost of care. And I would say so we have to have the regulatory environment supporting the innovation. Then we, of course, have to have innovators innovate, and that has to do with, American system, of course, which is the most advanced globally, and in Europe, it's not much different. So we have to have those two components, and I think the trend will continue. And then we have another trend for value-based care globally. In the United States, about 30% of providers follow the trend, and they deployed some sort of models internally. So I believe that we are, in the next 5 years, are going to see a meaningful change that will result in further decrease in the cost of care and improvement the quality of care.
Understood. Thank you, Sasha. I guess, as we're looking at the possibilities, and I would say the aligning of the various stakeholder groups in the health system, aggregate, this transformation around meeting the patient where they are is really only possible by the unlocking of data and the learning cycles that come from that data. Dr. L, I mean, you've been immersed in informatics from essentially, your undergraduate days doing computer science, I'm sure. Now you're looking at a current point of 2022, and you're seeing, I would imagine, pretty advanced capabilities against probably, new data sets you never imagined. Where are we today? And what's frustrating you as it relates to the various stakeholders that have to come together to unlock the potential?
That's a fantastic question. Thank you. Can you guys hear me okay? Excellent. Well, I would say that we have come a long way even through my career in medicine. When I started, we were on paper records, so we're a little bit beyond that. Where I think we started was we attempted to translate those paper records into computer systems. And as everyone understands, that direct translation doesn't work. And so we were able to transition to electronic medical records over the last 10 to 20 years. And now where we are, as I like to say, is that we have a lot of data in our computer systems. What we're lacking is information. That data that is in the computer systems is rich, it's vast, it is not possible to sift through it in a meaningful way to get to a place where we can truly impact patient care. So where I think we are today is we are recognizing that, which is a huge step forward, and we are looking at ways that we can really transform the way that we ingest that data that exists in our patient records. The other challenge that we have encountered with electronic medical records is that they've been very siloed. So they came up in sort of parallel, the inpatient records, the ambulatory records. And what we failed to recognize is that patient journey, as the patient traverses the healthcare system, really needs to be looked at holistically. And so as we're looking at ways that we can truly put that information in front of the clinician and give them the appropriate decision support at the right time, the right place, that will then translate into impact to patient outcomes, right? That's really the end goal that we're trying to get to. We need to consider how to marry all of that data into meaningful information and how to really paint a picture of the patient journey.
That's wonderful. It's such a great opportunity with two colleagues from the same organization that I'm sure play very closely together as it relates to how Novant Health and the greater Charlotte and other regions you impact. Amber, you're inside of a major health system running a major unit through the digital health lens and engagement lens. Meeting the patient where they are fundamentally is it got to be the burning question you're asking every day, taking into account Dr. L's narrative around where we are with data versus information. How does that play in your organization? Is that a rate limiting step? How are y'all addressing the difference between data and engagement versus information and engagement?
It's complex. It's difficult in healthcare. I come from a non-healthcare background, so as I lean on my past experiences where consumerism was first and foremost, when you cross into healthcare, there is now this flavor of consumerism that the patients are bringing, and the regulatory, the privacy, the sensitivity, and the uniqueness of every single one of those patients' journeys truly makes it far more difficult than the average consumer would appreciate. And so when we think about the engagement aspect, for me, it's important that we think about engagement and enablement that is balancing the patient and the physician, because that physician has to be enabled to meet that patient where they are and to do that successfully. So the marrying of data, of the demands of what our patients are saying they want, but then balancing it to what, from a compliance and regulatory standpoint, we actually can. And then for physicians like Dr. L to be able to practice that medicine appropriately. One thing I have become very sensitive to is the amount of data that we are presenting to our physicians is not necessarily helpful. We must turn it into information, and where we can't turn it into information, we have to continue to iterate until we find what's meaningful in that data that we have collected. And we have so many sources, we have so many repositories, and there is some great technology that does exist to analyze it and to create and identify trends and themes that we can act on. And that's where I think that data becomes information and we can use it to drive decisions. But to have a plethora of data and to have all of these sources and vast amounts of data lakes really isn't valuable unless we can identify the action that can be taken with that data. And so I think that is a bit of the complex challenge that is often underscored in this conversation.
Michael?
Yeah,
do you
please.
mind if I add a perspective?
Yeah, please.
I'm listening both Dr. Lozovatsky and Amber, and my entrepreneurial background cannot help but just to kick in, because I have an experience of building and bringing to market solutions across the entire healthcare system. What is really unique about healthcare is healthcare loves to buy pinpoint solutions. And just like what Amber was saying, the more solutions healthcare buys, the more data silos are there. And additionally, we have what I consider to be a great trend of consumerism. So now patients want to be playing doctors sometimes. Now we're Googling, now we also want to wear an Apple Watch and collect some data about this, and that. And we want to plug in that data that we're collecting in our own information about our health and our daily habits into our conversation with our healthcare provider, which is, just for this remark, right, is overwhelmed. Electronic medical records usage, that alone is overwhelming for clinicians. There is no surprise there, right? And then you add this additional data. And so it's very, very important to recognize for entrepreneurs and for patients that healthcare is very unique from, let's say, financial industry. So we have a lot of data silos. Additionally, we have a ton of data coming in, and it's actually useful data if plugged in into a conversation appropriately. And additionally, to make it even worse, I would say, since I'm a technologist, we have a lot of data standards to choose from, which is sort of kind of humorous, right? Because the data standard by default should identify one standard, not many. And we have many in the healthcare system. Which is why, unlike in the financial institution, let's say if you have a situation where for some reason an individual, let's say, was alerted for fraud, when this individual goes from one bank, let's say from Bank of America to Wells Fargo, when they're trying to open a checking account, at Wells Fargo, the teller immediately knows that there was an issue that they should be discussing with this person. In the healthcare world, this doesn't necessarily or rarely applies. Even within health system, when patient goes to get care to different, let's say they're going to different specialists, especially it gets sometimes complicated when it comes to pediatric care, because of course, as parents, we want to give the very best care to our child. And then sometimes, unfortunately, that requires a second or third opinion. And forget about data interoperability between the systems in different states. So there is a lot of complexity. I think one has to be aware of it in order for us to have a conversation about, a true, I would say, a involvement of a patient in the healthcare space is very different than of a consumer, let's say, in how they manage their banking relationship. So I'd like to just kind of pause there.
That's a very good point and distinction, of the challenges. I think, when we look at value-based care, and you mentioned this earlier, Sasha, and we look at trust, those two things to me are almost they're synonyms to each other as it relates to the point in which we as a society and a population trust the system. We're going to start delivering against the promise of value-based care, because it's in the relationship between the individual and themselves, the individual and their community, the individual and the system that is providing care for the individual, where trust is paramount. And now you're dealing with health data, and you're dealing with the provisions of services and solutions against the most intimate knowledge base. Eventually, maybe not now. How do you ensure trust is embedded in the equation?
That's a fantastic question. I think that a lot of this conversation has highlighted the challenges, right, with trust, as we've had more and more information available to patients, and not all of it, as we know, is good information. There's all kinds of things that people can find on Google. The trust factor has really become a huge challenge. We have transitioned from a paternalistic approach in medicine to a much more collaborative approach. And there's very much a positive to that, right? That is important. That trust is important. That patient-physician, patient-clinician relationship is really critical. Where I think the challenge is as that consumerism lens takes over in some settings, you lose some of the trust and you lose that value of the relationship. And when we think about the data piece that we were discussing, as was stated, a lot of it is valuable, a lot of it is not valuable, and you lose trust again when we're not able to deliver that data into meaningful information to our clinicians, such that then they can have the conversations with the patients, right? The expectation from the patient is when they walk in is that you know everything that's in the electronic medical record. I still see patients today. I can tell you that that is just not feasible. With the volumes of patients that we have, with the amount of information that is in those charts, it's just not feasible to be able to ingest all of it. And so as a system, our challenge is to make that as easy and accessible to our clinicians as possible, to build that trust with our patients when we have those interactions.
Any follow-up? Because I have a specific follow-up question. I'll just ask it. Amber, so carrying forward with trust, digital health and engagement is about transformation. It's a change model, right? Fundamentally, as we're producing services in the 21st century that are enabled by technology, generally we're focused on prevention, right? And the reorientation of our system service models from fee-for-service to pay-per-performance, right? Where are you finding the greatest, I would say, success right now in your organization implementing and driving change through these solutions and or programs that you're developing against?
Oh, that's a big question. I would say where I believe we have the greatest success right now, and the momentum that I'm finding, is where we are vetting and identifying partners, and I choose that word partners, not vendors. So for Novant Health, we are looking to identify folks who want to co-create and co-develop with us and develop a partnership and a collaboration, not transactional, not vendor type of relationships. And where we find the most momentum at the moment is where we are identifying solutions that are providing scale and flexibility that's helping us to reach more of our patients, where our clinicians don't necessarily have to have hands-on care, but we are still able to provide self-service options. We're able to provide some interactions, although it may be asynchronous. So we are looking for opportunities like in remote patient monitoring. There's certainly, that's kind of status quo now. It used to be just a few years ago, a bright, shiny new thing. It really has become a part of the way in which we are looking to increase in our ambulatory space primarily. And that may be through devices for remote patient monitoring, where there's ancillary devices that our patients may take home with them. We do this live today with bariatrics patients post-surgery. We do this with our high-risk hypertension moms and obstetrics. We also do this in our Heart and Vascular Institute. So in those spaces and in those use cases, we've worked with clinicians that are allowing us to find really meaningful use cases with the underpinnings of technology that is taking the care into the home. So there's a real trend to go into the home. There's a trend to scale what the clinicians are able to touch and engage with the patient, but not requiring it to be one-on-one and human touch every time. We're so strapped with our care teams today. So that's where we have a significant area of momentum. And then also similar in the concept of remote patient monitoring, where you think about a device, a weight scale, or blood pressure cuff that's connected by Bluetooth, we are finding more and more momentum with device-less remote patient monitoring. So something that's as simple as software as a medical device that's residing on a patient's phone, for example. There is momentum in that space. And then really looking to identify ways that we can virtualize some of the skilled clinicians that we have inside of our ambulatory and acute space that would allow us to provide support to a particular unit on a floor in the facility. Are we able to virtually admit and discharge patients rather than the bedside nurse doing that? So the bedside nurse can care for the patient hands-on, and virtually we're able to actually do that admission or that discharge paperwork, or doing some centralized nursing for our ambulatory clinics. So that's where it's a scale opportunity. Sure. where digital underpinnings Sure. are making that a reality.
So right now you're seeing, just to reiterate, some growth and maturity in creating additional capacity in our human resources by extending and or augmenting the operational or clinical service itself.
Correct. And the one piece I want to add to that, and I would invite Margaret or Sasha to opine as well, is point solutions were mentioned earlier. Yeah. So it's really important that there's a point solution on every corner now. And we really have to be very intentional when we are looking at a solution that it becomes a part of our workflow, or that physician and that care team is not going to be able to move the ball down the field with that particular new capability. And so when we are looking to bring in these solutions, we have to ensure that it will very seamlessly integrate into our EMR. And that's where partners like informatics and business units like digital health get really close and understanding what that clinical workflow could be. And if it's fragmented, then that's not going to be an ideal solution, and it wouldn't be a path that we would pursue in a third-party relationship.
Got it. Any follow-on comments, Sasha?
Yeah, I think entrepreneur in me is listening with stock joy. The conversation. And I want to zoom in on one point that I feel like is not talked about enough. And this goes back to you, actually, first question to me about the trends. So I'm going to try to be positive today, right? And zoom in on not on the work that needs to be done, but what's happening. That's awesome. I've been an entrepreneur in the digital health space for about 15 years. And one of the points that Amber just so casually made is important, and it's transforming healthcare. There is such a thing as co-creation that was not really a thing 15 years ago. Usually as an innovator, you create your solution, you think it fits the problem, you test it as much as you can with your customer, you get the feedback, and then you go to the health system and you try to sort of perfect your sales pitch in a way that they would recognize that indeed your solution solves their problem. But the conversation had shifted, and it's creating a lot more meaningful technology. So again, one of the quotes that I often see it being talked about or written about is, I like to say that in the healthcare space, it's not innovation for sake of innovation. It's about meaningful innovation that solves real problems with KPIs behind it, right? So it's not buzzy technology like AI, ML, IoT, blockchain, but it has to be practical. And co-creation makes innovation in the healthcare space practical. For example, Xelf is a really good example of a startup that was well-funded, came out as a co-creation project, and now it's a multi-million-dollar valuation startup, helps to prescribe technology, different technology within one place. Again, and there are many other examples, right? So that is an amazing trend that Amber just pointed out. Another positive thing that I wanted to kind of note, I would say, Dr. Lozovatsky was asked a question about trust. It's a really great question, and technology has a lot of solutions and answers to that. So in the pharmaceutical industry, we're now seeing a deployment of blockchain. Blockchain is fabulous. I think blockchain is often misunderstood because in financial industry, you have good and bad, right? But, Bitcoin is not very useful for me to be talking about in the healthcare setting. And there is often again, misunderstanding all that blockchain can deliver. Again, a blockchain is fabulous, and a consent is one of the great applications that we're now deploying in life sciences that allows for patients to own their data, control their data, and use it to get answers and help and treatment for their disease states. Yeah. So that's wonderful. And another good potential application of AI and ML in the healthcare space, one of the points that Dr. Lozovatsky made was there is a complexity, and again, bringing all of the data together, right? And from all of the even internal solutions that providers are using, right? And at the point of care, actually meaningfully use it. And AI and ML could really help out. There are a lot of solutions out there that some of them are based on disease states, they do analytics, and then they provide an insight. Again, not replacing a doctor, but providing an insight during the point of care. And I think that is a slow shift. I think when Watson Health came about, they really, I think, scared the industry, because I think in a lot of providers' mind, they were thinking doctors have been replaced. And I've actually have had phone conversations with moms of medical students who are asking me, so now basically there are people like you who are making doctors' jobs obsolete. Yeah. No. Yeah. Well, as long as we will have humans, we will need a human interaction, and we will value provider care, in-person provider care. But, there are ways that technology can make the cost of care to go down and, again, involve patients in care and give more of an insight to a provider and so on and so forth.
Absolutely. And, I posit and I'll kind of share DHIT's kind of position in the matter. It's 1922 in the 21st century. Think about that. 100 years ago, we just started experimenting with cars on the road, right? The possibilities of radical transformation in transportation weren't even thought about in the context of what we were living in by 1970, let alone what we're at right now. So we're at the beginning of the roaring 20s in the 21st century, okay? We're just scratching the tip of the possibilities of what the world's going to look like in 10 to 20 years as it relates to freeing health data, building an adaptive ecosystem of supplies to the idiosyncratic nature of what a patient is, i.e. what Michael Levy is in my day and time and life and community and socioeconomic mental health status, just tipping that. So I then posit this question to kind of wrap up before Q&A. Dr. L, by 2030, 8 more years of rolling up the sleeves and doing it, right? Where are we? What's the world look like in your head?
That is a fantastic question. I hope that where we are is that we have answered some of the complexity, some of the questions that were brought up today, right? And we get to a place where we truly are able to use technology to be an accelerator. There were a few things that were said that I want to highlight that I think will answer the question of where we need to be. One of them is that there's lots of point solutions. There's lots of great thinking. We have to always take a step back and ask, what is the problem we're trying to solve? That is often missing in the innovation space. And then the other piece that I think is really critical that was mentioned is that whatever solution we come up with needs to be integrated into the clinical workflow. Again, this is not an easy thing to do, but what is really important for us to consider is sometimes the most impactful, most eloquent solutions are not the ones that we're thinking are going to transform all of healthcare, but they're eloquent in the background and have huge impact to the patient outcome. So that's the third thing that I want everyone to think about is the goal of using technology in medicine is ultimately to impact patient care. We want to help the patients, right? And all of the steps in the middle are just the steps to get us there. Those are what I call process measures versus outcome measures. And so where I hope that we are is that we continue to look at our processes in healthcare and tackle the challenges one by one, come up with solutions that truly are eloquent in a way that are integrated into what exists today and get us to a better place from a patient outcome perspective.
Wonderful. Thank you, Dr. L. And I think that does give us 3 minutes now on the dot to open for a question or two for our panelists. Thank you.
So I love the question about the future of 2030. So I really would be curious as to what processes or procedure do you think, we talked about today, the state of patient care today, but taking and being where the patient, where they will be. What kind of processes do you think we need to have to be nimble and agile enough to be prepared for what clinical workflow is in 2030? Because it will likely not be what it is today.
Great question. I think you got to start by asking what perspective are you sitting in? What lens are you sitting in this ecosystem of care? Are you a patient? Are you a provider? Are you a payer? Are you a community organization, public health entity, et cetera? But considering we have 2 system leaders here, do you all want to try to answer just from a PNP perspective? What's norm in 2030?
Well, it's hard to say what the norm will be, but what I can say from a macro perspective is that we need to decrease some of the friction, and that will happen from all perspectives, right? So from a patient perspective, we need to improve our access to care. We need to improve the ability to contact the healthcare system to be able to get the care they need in the venue that they want, right? To me, all of that is friction. From a provider perspective and any really clinician perspective, we need to be able to help them see patients efficiently, to get the information that they need. We need to really look at our reimbursement models and align them with patient outcomes. We barely touched on that, but that's really where value-based care is. From a payer perspective, it's going to be a whole different lens. But if we're really focused on the patient and provider relationship, I think it boils down to decreasing the friction on both sides to make that relationship more productive, smoother, and improve patient outcomes at the end of the day.
A few points just to add on from a business standpoint, that we've lightly touched on, but is going to be really impactful for how things shape going forward. That is going to be to fully move into a value-based care model and commit. So for systems that are functioning in both of those camps, fee-for-service and value-based care, it's extremely difficult from a reimbursement and a management from a financial model standpoint. So that really has to get reconciled. Secondly, I would offer that the regulations and the oversight of our healthcare systems are quite disparate. They vary by state. It's very difficult to manage that when you have a virtual care team that is not physically sitting in the same room as the patient, but yet you must follow licensure that's only in the state of where that patient happens to be sitting that day. Right? So some of those barriers really need to be broken down in addition to what parity and reimbursement looks like that's very fair for our physicians that are actually delivering the care and the systems that are making that possible.
Awesome. So I think that, do I have room for one more question? Or?
We do not, unfortunately.
That's
it's
it.
Me, bad cop again.
Well,
done.
I think to end, we got to rethink, redesign, re-engineer, recalibrate around collaboration, not competition, to build a community around co-living, co-learning, and co-development. That's what I heard today, where trust sits in the middle of collaboration and partnership and building over time with learning cycles driven by data that ask what we can do today and what we need to build for tomorrow. That seems like the new operating model. Thank you so much, Amber, Dr. L, Sasha, Team RevTech, Dan, thank you so much. Okay, awesome, thanks.
Thank you so much, guys.